So a question that comes up a lot is, what is the difference between fat transfer and facial fillers? So let's first discuss what a facial filler is and why it's used. So the main reason why fillers or even fat transfer are on the table in the first place is because our faces, we lose volume as we age. We start to see a loss of fat around the eyes or temples or cheeks or lips, around our jawline. All these areas start to see the fat pads constrict, and as a result, we start to look deflated and tired looking. Now, that's not the same as laxity. That's volume loss, and that can happen anywhere in our early to mid 30s, and it gets worse and worse as time goes on. So in order to restore some of that volume, you're going to use something that fills, now either a filler or fat transfer. So what are the differences? Fillers are man-made. They are usually something that is derived from a natural occurring product like a hyaluronic acid that is then sort of put together as a unique molecule that once it's injected in the form of a gel, your body doesn't immediately get rid of it, but slowly but surely kind of breaks it down. So the fundamental aspect of a filler is that it's a foreign body that's being injected. It fills the tissues, and your body slowly over time starts to break down the filler. And so as a result, you could get anywhere from 6 months to 9 months to a year, depending on the filler and depending on the location, where you get some volume. The problem is, if you think about it, once the filler goes in, you look your best, shortly after the injection, once the swelling and possible bruising and all that stuff goes away, you look your best, but slowly over time, you start to get deflated again. And as a result, your face kind of goes through this period, because once it starts to deflate, you go in for another round of injections and you do this and it goes up and down. Problem with that is that you're never looking constant, and you're in your mind, you're always thinking, when is the next time I need to go in for a filler? When's the next time I need to get a volume? So it's always this top of mind type of an issue. Now, fat transfer is different, and that fat transfer, as the name implies, is fat that's taken from one part of the body and it's injected into the areas where you've lost volume. And because it is a product of your own body, it's a tissue that comes from you, it's in a category called a graft. And grafts are commonly used in surgery. There's cartilage grafts that are used in rhinoplasty. There's bone grafts that are used in dentistry and orthopedic surgery. There's hair grafts that are used when you do hair transplants. There's skin grafts in dermatology. There's even coronary artery grafts that are used in heart surgery, right? So this concept of moving tissue around in our body is very commonplace and very, very, typical for our bodies to accept that graft as a new part of the area it's been transferred to. So what we're doing with fat is exactly that. We're taking fat grafts from either the stomach or the thighs, and then we're injecting it into the face. And once that happens, it becomes a permanent part of the tissue. The blood supply into the local tissues attach to these fat grafts, and then as a result, you get this stable, long-term area of the face that has been restored with fat. So instead of having to put something in temporary like a filler, you're using something permanent like in fat. So that's the biggest difference between the two, is its longevity and the fact that it's your own body's material. It's not a foreign body. Your body doesn't have any type of inflammatory or immunologic response to it. And why that's important is because these fillers over time, if you're constantly in this chronic inflammatory state, the tissues start to form scar. And when they form scar, they start to get hard, they start to get irregular, and those changes are permanent. And the lifestyle aspect of it is, once you get a fat transfer done and you get the area corrected, if it's done properly, you're done. You don't need any more volume again. I mean, that's a huge liberating factor to a lifestyle. You're not looking for the next time you have to go in. You're not watching your face melt and then get it filled again. So there's a lot of major advantages and differences between that, the two procedures. But the main ones is its permanence, how natural it is, and in the right hands, it can treat the entire area of the face that has lost volume, as opposed to pinpoint treatments, for example, the lips or the cheeks or whatever, which over time leads to an irregular and unusual look. I hope that helped answer a very, very common question that comes up about filler versus fat transfer. In my practice, I do almost a fat transfer a day. I've done over 5,000 in the last 15 years. It's a procedure that I'm hugely a proponent of and believe in. And if there's any other questions specific to that, please check out my website. We have other videos here on the YouTube channel as well as my Instagram that goes through that. Thanks so much.